A very good evening to you, our esteemed viewers. We are indeed glad that you're still watching Family TV. Thank you so much for choosing Family TV among the very many stations. That keeps us moving. You encourage us, you motivate us. Each time we know that you are right there watching us. This is Health Pot. And remember, this program is brought to you by Makerere School of Public Health, together with Family TV, and we are basically looking at maternal health and early childhood development. Edrine Osteen Mukalazi is my name, and we have our guest today right here with us, and this is Charles Ssemugabo. He's going to take us through what we introduced earlier with Dr. Olive Kovsinje, that is unintentional injuries in children. But we are going to advance it a bit and look at urban environment as well, together with unintentional injuries. So let's join in and we welcome Charles Ssemugabo. Charles, you're most welcome to today's show.
Thank you, Edwin.
Yeah, kindly greet our esteemed viewers.
Good evening, viewers. I'm glad to be here, and I hope you're keeping safe.
So, Charles, earlier on, when Dr. Olive Kovsinje was addressing us, she told us that unintentional injuries is the sixth cause of death among children. And this is so scaring because I believe they're somehow neglected. And a few people talk about these injuries. She talked about a few, but I think let us now begin with urban environment. What do you have to say about the urban environment?
Yeah, so a lot of injuries happen, and really some really severe injuries happen within our home environments, and more really in urban environments as compared to rural environments, especially because of the risks that are involved, or that the urban environment actually contributes to this burden. So here we will probably look at about two environments, and the first one is the slum environment.
And we know that, if we take our Kampala setting, most of the suburbs are slums.
Yes, so you find that about 50+% of, or almost 60% of, people in urban areas in Uganda live in a slum-like setting.
Yes.
And many of us have grown up really in those environments.
Yeah.
And some of us have in our childhood experienced such injuries, or we have friends, we have relatives we know that have experienced such injuries, some who really have died, but others are living with scars or disabilities because of these injuries that happened to them in the early days of their life.
But then I think no one minds about these injuries. We think they are ordinary injuries, they are part of life. When someone is growing, they should go through this. They should have these injuries.
Well, it depends on how you look at them. Like I've earlier said, that you might get it, it may heal, it might be not as severe.
Yeah.
But your friend or your brother is going to get it, and they might die, or they might drown into a pitch and die, or they fall off a building and die, or they get a disability that is going to be with them all their life. So we don't need to be negligent of this. We need to really focus on making sure that our environments or urban environments are free of such risks that expose kids to these injuries.
So let's basically look at, first of all, the slum setting. Yeah, and what are the risks that are accompanied?
Yeah, so there are quite a number, and these again match with the causes and the kind of injuries that kids do experience. You well know that you're living in a crowded slum environment, and you don't have a kitchen.
Yeah.
You don't have. So you find that you're cooking within either the house or you're cooking at the veranda.
Yeah.
And this is the same environment in which a toddler is, and they don't.
And that is the compound they have to play in.
Yes, and these kids, we've all known when we are growing up that there's a lot of curiosity to learn. So you're going to go touching everywhere. You don't know that this thing is hot. You're touching it. You're touching there, and kids end up being really, really bad. The other risk is, of course, the very uneven environment in our slum areas. So your house is here. There is there is a drainage. There is even a road in the middle. Then there is a cliff, or there is a raised balcony, or there is kids can easily fall off those environments. And then, of course, slums are really poorly drained, or many of them in low-lying areas, and so there are a lot of drainage channels, and kids can fall in there.
Yeah.
We've had instances where it has rained and the kid is washed away in those drains and they die. Like we've had some of those instances in slum areas.
And the blame is now put for Kampala cases. The blame is put on KCCA.
Yes.
No parent blames themselves.
Yeah, and indeed, because it's a collective responsibility. You as a mother, you have to play your role, because you actually know the environment in which you live, but also KCC has to play their role. So it's a collective responsibility. So you first play your role first, and then we will see what the other authorities have to do. Yeah, so the other risks, again, like I've said, a lot of access roads in these settings in the slums, and sometimes traffic. Someone is passing through with a car or a bicycle or a motorcycle, and the kid is playing in there because that's their compound, that's their play area. We do not have a lot of planned play areas like our colleagues in the US or in Europe do. That after every 3-5 households there is a green space where kids can play. Now in these slum areas, that is barely there, and so a child has to find.
It is the road, it is the pitch, it is the everything.
Yes. And so that also does sometimes expose them to traffic related injuries, but also the kind of behaviors and the overcrowding itself, right? It's the same bed. It's the same bed. The child sleeps. The father, the mother, and then the other siblings are staying down. If a father comes back a bit drunk, they can easily fall on a 6-year-old, a 6-month-old baby.
Exactly.
And so it's even the violence that happens in the home, because if a mother is probably not in good terms with the father and they're pulling ropes, starting to fight, they might end up hitting the child. And we've had in one of our studies that we did in Jinja, we had such instances. Yeah, there are also animals, snakes, dogs. These also do happen even in these urban environments, and they can end up stinging kids and things of that nature. Then there are also sharps, because these could be in the home or even outside the home, and all these also do really expose kids to injuries. And of course, lately also we've been seeing some disturbing photos of or instances of kids falling off apartments. And that's also a risk. It's interesting how we transitioned from the normal home that we knew, a big bungalow house with a compound and things of that nature, to now, more of apartments
and I think before we go to the apartments, let us first of all consider the slum setting. Yeah, we have another challenge of poor disposal of probably I would call them safety materials like needles, syringes, laser blades, and what. And then don't these also expose these children to risks?
Yeah, so this
because they find a community clinic, they have nowhere to deposit their waste, so all they do is to get this, dump it into a drainage or.
Yeah, so there's also major risks, and recently we did a study on urban risks in a slum here in Kasuri, and so we were using photo voice. So you take a photo and then of a risk, and then talk about the key messages in there, and many photos came back with kids playing on dustbins or on waste collection points, and yes, so this is also a huge risk, and sometimes it's beyond just the clinic. So I might have hired someone to manage my waste, and they choose to handle it that way, just indiscriminately throw it anywhere, and that but also nails and things of that nature. So there are really huge risks.
Glasses and all that.
Yeah.
And then some other people also construct their fences. Maybe they want to exclude themselves from this other community, which might not be of the same social class with them. But then on their perimeter wall, they put glasses, broken glasses, as guards.
Yeah.
Isn't this also exposing our children to risks, to injuries?
Yeah, that is also a risk, especially that the other point that I earlier talked about, the curiosity in a child. We've all been kids, and we were really wanting to see or to know or to learn or climb things carelessly. So if you have a perimeter wall that has that, and the child, they may think that they are smart, that they can hold the other edges that don't have the sharps. But eventually, when it's what if that edge snaps and then he holds on to, or she holds on to that sharp? So it's if we are talking, reducing risk, that's a major risk that we need to probably do away with.
Well, Charles, let's go for a short commercial break, and then when we come back, we are going to continue with the environment, and then environment and the unintentional injuries.
As you think about the Lord just taking over your case, and you are no longer in the midst of it, and He says, "Fear not."
Demons from the mountains, scream and leave.
In the name of
Demons from the graves, scream and leave in the name of Jesus.
Welcome back from the commercial break. This is Health Port, and this program is brought to you by Makerere School of Public Health. We are basically looking at early childhood development and maternal health. And today we are with Charles. We are still continuing with unintentional injuries, and today we are looking at the environment specifically. So before we went for the commercial break, we are actually looking at the slums. But we also have another class of people, and these are people who live or who reside in apartments. don't you think you also have risks? Don't you think the children, to those people who live in apartments, have risks or at risk of unintentional injuries? Well, Charles is here to answer that question. Before we went for the commercial break, we had looked at the slums, and now I want us to look at the apartments. Yeah, the flats, and that, because sometimes these people who live in slums admire those in apartments. They think if their children were in those apartments, they would be maybe better, not at risk. So, what about those people who live in apartments? Do they have any risks that they're subjected to?
Yeah, absolutely. And it's interesting how we've transitioned very quickly. When I was growing up, these living in apartments and was not a very common thing, and we largely knew it about Indians, and we knew that Indians are the ones that most of the times sleep in such environments. I remember when I just finished university and I was renting, on a flat around Makerere. A friend of mine, a female friend, came to visit, and the question she asked me is like, "Why are you staying in a flat? Are you an Indian?" I laughed, and I was like, "Really? What kind of a question this is?" But over time, apartments have become the real thing, and now many people in and around Kampala are staying in apartments, and they are pretty much the same risks even within apartments. But of course, not the risk score may not be as high in that setting as it is in the slums. But I'll pick a few and one of the major risks that I've started actually noticing about these apartments is the fact that if the balcons are not well guarded, if the windows are not well meshed and filled with some burglar proof, it's a risk to kids. If a child can quickly open the window and want to look down and see what's there, it's a big risk. I've seen about 3 instances of kids who have fallen off an apartment and died, and it's very absurd because the first thing to hit the ground is the head.
Yeah.
And then you can't do anything. They're dead. So it's a huge risk. It's really a huge risk. And
so should we attach this to the construction department, or the people who are into construction, that they don't take a lot of caution while?
Yeah, most of it you could probably connect it to the design and construction. And my point here is that people are building these as though they're just going to be offices, yeah, or shops, and yet they are going to be residences of families. Some families are going to live in them for forever, and they're going to grow their kids in there. So they need the design of, say, the balcony, the windows, the doors need to be in such a way that, especially those that first, second, third floor, they need to be in a way that a small child cannot fall into out of the balcony or through the window, and then either hurt themselves or even die. So I think people in this business, and even the regulators, the KCCA, or the division authorities, the health inspectors, need to look into the building plan, and even because they're supposed to give inspect before it is habited. And and the purpose, of course, also clearly highlighted that these are going to be residential, and then look into how do we, or is this really fit, or if it's not fit, what needs to be done to ensure safety of children under fire.
I look at another instance where a parent is a bit negligent. Why? Yes, the plan has a provision of maybe guards or on the balcons and that. But then this according to the plan, the space between the bars is a bit big that a child can really go through, and children may use it as a playground. Someone goes out through this, enters back through the other one, like that, and then a parent doesn't take caution to monitor this child, so you don't know when they will fall down.
Yeah, so of course, good point, and indeed, as parents, we really need to watch out for our kids. But there is so much supervision you can do, right? Because if you're going to excuse yourself, or if you're cooking, or if you are watching something, you can't always be in control. Yeah. Especially with kids, because sometimes they're going to go loose. So it's important that as parents, we really need to supervise these kids, but at the same time, we need to ensure that that risk is sorted. Otherwise, if it still remains there, supervision cannot cover up for that risk, because like I've said, there is so much supervision you can do that at some point you will be taken away. Yeah. So
what do you think parents should do to reduce the number of risks? We need to as parents, we need to look out for in our environment. We need, like Dr. Olive earlier said in the previous show, kids are not little adults. Kids are kids. And we should not look at them as adults. Yes, they are kids. They are very curious. They are very, very curious, especially the boys. And even literature shows that the reason kids get a lot of these injuries is because of their curiosity. And aggressive behavior and things. They want to play, they want to know, they want. So they need to do this in a safe environment, and we need to see, okay, are these staircases safe enough for a child if they are walking up? If you're an apartment per se, is the guardrail thin enough, with the spaces thin enough for a child not to fall through, right? If there is provision to climb, can a child climb here? What can I do to reduce on the climbing? Because they may be climbing to play, but while they are playing, they are going to fall off. Yeah. So you need to take away that. Right? If the windows, very easy to open, you need to ensure that, maybe the lock is a bit difficult for them to open, such that it's you only who can open it, and then also ensure that the metal bars within the window are thin enough for a child to not to fall through them. Yeah, and a lot of these risks, the sharps in a household. Yeah. The knives, the razor blades. We need to find a safe way of keeping them. And some breakable bottles. Yes. Are kept carelessly anywhere. Have some cabinets. Put all these sharps in, and a cabinet that a child cannot easily open. Such that you take away that risk. Medicines. Yeah. Just if you're a farming community, or you bought something to spray mosquitoes at night,
make sure you put it at a height that a child cannot reach, or you put it, in a cabinet or where a child cannot easily access it, such that they can play with, in a safe environment. Otherwise, you're going to find when they have taken the medicine or they have taken this pesticide and it has poisoned them and things of that nature. So again, beds. We need to make sure that the beds that our kids sleep in are safe enough for them not to fall off. Right? I visited a friend recently and child was sleeping and she just climbed. And I'm like, I hope she don't
And sometimes
fall.
they climb while playing, so
Yes.
you never know when they'll fall.
Yes. Yes. So it's very critical. And remember that when a child, okay, right now not a lot of schooling, but a child may end up missing a year of school. And that might have an impact on them, Now with COVID, imagine someone who had, finished Form 6, and now someone who had not finished. If your child had stayed back because they had an injury, they're going to lose 2 years or so. So that will have an impact on them. So, some things you see them right up, but the impact, they may miss an opportunity. A job opportunity that was there, but because they were not ready. So we need to ensure really that those risks are not within the environments. And again, that's where now supervision comes in, because there is so much that we can do. Some risks you can't help. For example, if you're staying in an apartment and it's not yours, it's someone else's apartment.
You may not come in to dictate what designs you want to be in.
Yeah, but you might raise this issue to them, but they may not be willing to say, okay, let's get like this and that. But again, you need to look out. So that's where now supervision comes in. Really knowing that there's a risk here. So if a child goes this side, I either tell them not to play from there, or show them actually the actual risk and say, if you do this, you're going to fall down. And then they know. Or you instill some sort of fear.
Just that some children are naughty. You tell them when you do this, you'll fall down. And they say, let me see if I can fall.
Yeah, but indeed, we need to find really ways of ensuring that our environments are safe. These early days of life are very, very important.
Yeah.
And so if a child, gets such an injury that is severe enough to their lives, or a burn that, is going to take them some days, on a hospital bed, really they might not grow as planned.
Well, thank you so much, Charles. We're indeed grateful. I believe you, the parent out there, not only the mothers, even the fathers, the caretakers, I believe you're learning a lot from these programs. From the time we introduced this topic of unintentional injuries, because we talked about unintentional injuries, we talked about drowning, and now we are talking about the environment. So I believe you are learning and you're taking caution. At least you should now choose to save that child from what the researchers tell us here. This is HealthPod. This program is brought to you by Makerere School of Public Health, together with Family TV, and basically looking at maternal health and early childhood development. Thank you so much, you who started with us, and you are still with us. Edrine Osteen Mukalazi is my name. I have worked with Jonah Jao, the producer. I've worked with Tony Sant on social media, and I've also worked with Bantam in transmission. Have a good night. Enjoy your weekend. Till we meet again next week.